Okay, it's 8 o'clock on Friday morning. I'm your host, Kerry Jeffrey of Emotional Autoimmunity. Welcome to the first official live here for this new series that's going to happen at this time every single week, where I'm going to be talking about the issues that are important to you. And one of the biggest things that's come through is communication and lack of belief in people, and how to get people to believe that you have chronic illness and believe that you have the issues that you have, and to really understand that there is actually something going on despite the fact that you normally look normal. Okay, and these are all the challenges that come with living with a chronic illness. And for those of you who aren't that familiar with me, I'm a clinical hypnotherapist, counsellor, life coach. I help people with chronic illness move through the trauma, the depression, and the anxiety to create a new emotional foundation where you can really start taking control of your life, your health, and your illness. And I myself live with 3 autoimmune conditions. So I have Hashimoto's, antiphospholipid syndrome, and celiac disease. So today we're going to talk about the baseline issue, which is one of the biggest blocks for most people that stop us from getting a diagnosis or moving forward so that we can start to make a plan for our health, and that's dealing with the medical profession. So the whole purpose of these conversations that I'm having with you is to do it in a relatively short time, to give you a few tips that you can use, start using straight away. They're going to help you benefit your health and your life and your situation. So before you even approach the doctor, before you think about approaching the doctor, the biggest thing that needs to happen is that you need to believe yourself. All right? You need to actually believe there is something wrong with you. Because if you go into that meeting with your doctor and you're wavering or you're uncertain, then you don't have the courage of your convictions, right? Your ability to influence someone is directly proportional to the amount of conviction that you have about the situation. So the people who are able to persuade, the people who are able to get people on board are the ones who absolutely believe in the things that they're saying. They believe them to be true. So you don't want any doubt in your mind. If you go in there with any doubt, then that's going to come across and be picked up. So the first thing that you need to do is you need to believe that there is something wrong. Don't let other people influence you. Don't let yourself minimize it or trivialize it. If you listen to your gut, if you listen to your instinct and not the fear-based voice, which is just fear, right? Fear is normally giving you a whole lot of what ifs. But your intuition is the quiet voice that just knows. It'll just say to you, this isn't normal. There's something not right. There's something going on here. And that's what you need to listen to. So that's number one. Go into the doctor's office with that courage of your own convictions, in the firm belief there is something wrong, that this is not normal for you, and that you need their help and support to find out what the issue is, so that together you can both start working on it and try to find some sort of solution that's going to improve your health. So that's number one. The second thing you need to keep in mind is that doctors have a very limited time to spend with you. We're talking maybe 10 to 15 minutes. You are one of many, many people they see each day. That doctors generally in most countries with their healthcare system are being pushed constantly to see more people for less time. And the burnout rate in any of the helping professions, which includes nursing, doctors, specialists, surgeons, psychiatrists, psychologists, social workers, and therapists like myself, is incredibly high, because when you are constantly exposed to lots of people in either physical or emotional pain, where generally there is actually not that much you can do to help them in a medical setting, the burnout rate is high, because most people, unless they're going in it for the money, right, strictly for the money, most people go into the helping profession out of a genuine desire to heal and to help and to alleviate suffering. And when you find out that you can't do that, and you're faced with hundreds of thousands of people that you actually can't do much to help, it's incredibly disheartening. And many people have to become very cold in order to deal with the reality of it. They need to shut down. They need to shut off their empathy. They need to shut off their emotions so that they can protect themselves. So it's not out of malice, it's out of self-protection. Because unless you are really, really good at having boundaries and being very clear about what's yours and what's not yours, you are going to burn out. And it's just something that happens. Carers suffer from empathy burnout. Everybody exposed to a lot of emotional pain or physical pain eventually gets empathy burnout, where you simply can't deal with it anymore and you need a break from it. So that's the first thing to remember with doctors. They have limited time, a high amount of burnout. They're dealing with a lot of people in a lot of pain, and there's only so much that they can do. So just be aware of their state of mind going in. Just keep that tucked in the back of your mind. So the next thing that I need to mention, number 3, is when you are going to the doctors as part of your preparation, you want to focus on the key physical issues that you are experiencing clearly and concisely, because you have limited time. So talk about what are the main physical issues. Do not talk about emotional issues. Do not mention anxiety. Do not mention depression. The minute you mention anxiety and depression, they are going to switch off from listening to a medical perspective to an emotional or a psychological perspective. They will recommend antidepressants. They will recommend counseling. So you have to stick to their area of expertise, which is physical symptoms, and be as clear as possible. So talk about specific things. Say that I am noticing that I get pain in this part of my chest, that I'm experiencing constant pain in this area all the time, that I have swelling in my feet and ankles, that I have gained, a lot of weight with no change, that my energy is not enough to get me through the day. So I'm not talking about being tired. So make it very clear. It is not tiredness. I've experienced tiredness. I've had young children. I know how it is. This feels very different. It literally feels like I do not have any energy. So be very clear, be very specific. Where is the pain? Where is the symptom? What is the intensity? How is it impacting you? Don't talk about, as I said, don't talk about anxiety. Don't talk about depression. Talk about pain. Talk about location. Talk about direct physical impact, and underline the fact this is not normal. Tell them about the length of time that it's been going on. For example, if I was talking about my thyroid symptoms, I would say, I feel like I can't put anything around my throat because it feels too restrictive. There's pain. It feels like there's a blockage in my throat. So talk very specifically about what the issues are. Number 4, go in with a collaborative approach, all right? To get people on side, you want to make this a joint problem. You want to invite them to come up with a solution for you. So talk about talk about things like, I would really like us to work together on this. I feel like we need information about this. Be collaborative. Just go in there and say, look, Dr. Jones, I really need your help. I'm experiencing something that is not normal for me. I'm very concerned. I'm very concerned about my health and the impact that this is going to have on my future. I feel there is something very wrong and I really need your help and support in getting to the bottom of this, right? So go in with a collaborative attitude towards it, make it a joint issue. So in your language, be friendly, be collaborative. And certainly the one thing that you do not want to do not give all your power over to them. Do not go in there and dump the problem on their lap in a way that could be construed as, they're trying to get you to take full responsibility for it. Go in there and say, I need your help, not I need you to fix this problem, or, you need to help me, or I can't deal with this. You don't want any of that. You want to go in and be collaborative about it and just say, I would really appreciate your support. I would, we need to work on this together. I'm confident you're going to be able to help me. It doesn't hurt to butter them up a little bit. Everybody likes to be appreciated. Okay, so go in and be collaborative and don't give all their power away. Because the reality of this, guys, is that no matter if you get a diagnosis or not, right, when you have a chronic illness, 85 to 95 to 98% of what we can do to improve our health isn't with the doctor. Like, certainly there, for specific illnesses, there are drugs that are incredibly helpful to have. That can help to alleviate a lot of symptoms, that can help to improve our quality of life. But all of the other things, the way that we think, whether we deal with our trauma or not, whether we've got the right mindset, whether we're eating foods that are inflammatory or not, how much sleep we're getting, how much stress is in our lives, all of those things are within our control, and those things have the biggest impact on our day-to-day ability to cope, our ability for our bodies to heal, and our ability for our bodies to actually get back into rest and digest, which is what we want. That's where the healing happens, rather than fight, flight, or freeze, where we are when we're in a high stress, high pain, unwell situation. So the doctor is only going to give you a label, and while it's an important label, especially if you have to go for disability or something like that, it's going to be a very small fraction. They're really only going to be diagnosing and prescribing, and the rest is going to be up to you. So do not hand them all of your power. You have got to drive this. And the last one, number 5, is be persistent and assertive about getting testing. So if there are certain tests that you want, like if they insist on only doing a TSH test, which is not a thyroid hormone, it is a pituitary signal to the thyroid gland to make more thyroid hormone. So it is not a thyroid hormone. If you want to find out how much actual thyroid hormone levels you have in your body, you need a full thyroid panel. So if they say, yes, we'll do a thyroid test, and you can ask, okay, what does that involve? And they'll say, we're going to do a TSH test. What you can say is, look, I really think it would be better if we had more information to work with. So what I would like to have done is a full thyroid panel so that we can actually see the amount of thyroid hormones that are presently in my body. Now, if you approach it that way, your chances of getting an answer is good. They might say, well, generally a TSH is enough, and you can say, yeah, okay, I get that. However, I would feel much more confident and I would feel better, and I feel that we would have much more valuable information if we actually see how much thyroid hormones that I have at this moment, and also to test if there's any thyroid antibodies, just to rule out, Hashimoto's or Graves' disease. That would be great. Now, if you strike a doctor who says, no, that's completely unnecessary, that's a waste of time, then what you can say is, okay, that's fine, doctor. What I would like you to do, can you just note on my file now that I requested that you do that test and you have chosen not to do it? And just see what they say. If they say, oh, but, well, just say, well, no, look, if you're really firm and fixed on this, and you're really saying that you're only prepared to do the TSH test, well, all right, I respect that, but I would like you to note on file for the future that I did request, and I requested the reasons why I want this test, which is that I want to see how much thyroid hormones I actually have, because that can determine, how I feel, and that will give us more information. If you can just note on my file now while I'm here that you are refusing to do that test. And you're applying a bit of heat, right? You're applying a bit of pressure. And really, there's no reason why they should not do the test. It is not coming out of their own pocket. They're not paying for it. If it's covered by your insurance in the country that you're in, there's really no reason why. They're creating more jobs for other people in the medical industry. So, sometimes they just get caught up on those things. So you've got to understand that a doctor can only meet you at the level of knowledge that they have. And when they hit the limits of that experience, or when they hit the limits of their level of knowledge, then it's going to be time probably to find somebody else if you can't, using all of these techniques I've just given you, get them to shift what their stance is, get them on side, use your ability to persuade and that collaborative approach, so that they are feeling that we are working on this together, and you're not just somebody who is scared and angry and blaming them, and putting all of the weight of responsibility on them and going in there in victim mode, rather than going in there as, an adult who knows there is something wrong, who believes there is something wrong, and is determined to work with that person to get to the bottom of it. So before I wrap up, if you do have any questions, please feel free to add them in chat. While I'm on, I'm just going to recap what we've talked about. So today we've talked about how to get the best from your doctor. So how to talk to your doctor for the best results. So number one was, first you've got to believe in yourself, right? You need to believe there is something wrong, and you go in there absolutely convinced there is something wrong, that this is not normal for me, and that I need your help to get to the bottom of this. When you believe in what you are saying, your ability to persuade people is a lot stronger, and you have a lot more chance of getting what you want, right? As two, remember, doctors have a limited time, very high burnout rates. Generally, it's very difficult to be around people that are in a lot of pain, and in order to protect themselves, they've got to shut down. So sometimes they do become a little bit cold and a little bit callous, just in order to protect themselves. So just remember that. Don't have your expectations too high, that they're going to be, lovely and warm and empathic and caring, because you're not there to have them be your best friend. You're there because they're a professional. Remember, they're a service provider. You're there to get a service. That's what you're there for, not to be their best friend. Okay. 3, talk about the key physical issues. Do not talk about emotional issues. Do not mention anxiety. Do not mention depression. The minute you do, boom, they're going to turn off. They're going to get out their prescription pad. They're going to write you out and offer you an antidepressant, or they're going to send you to a therapist. That is what's going to happen. I can guarantee it. Stick to the physical. Be specific. Give them your top 3 to 5 symptoms and why that is worrying for you, and reiterate that it is not normal. 4, go in there with a collaborative approach. Talk about we. Talk about, I would like you to help me. I would like us to work on this together. I'd like us to get to the bottom of this. Make it inclusive. Get them on board, right? Make it a joint issue. Show them you're willing to take responsibility for your part and you're not dumping it all in their lap. And when it comes to testing, be persistent and assertive, all right? Talk about why you want the test. So don't mention about you Googled and all of that sort of stuff. Just say, I know certain people going through these. They found this test was very, very helpful. I understand it's included on my insurance. I would like to have a full thyroid panel because I believe that it will give us more information about exactly where my thyroid hormones are, rather than just doing a TSH test, okay? If they don't do it, that's time to say, okay, doctor, I understand your point of view. However, I would like you just to note on the records that I have requested this test and the reasons why, and that you are refusing to run it. Now, that is assertive, and they are offering a service, right? Remember, service provider. If they are not giving you good service, then you want that noted. You want to push back a little, and then you're going to have that on your file. It's going to put a little bit of pressure on them and get them to challenge their own beliefs and whether they're just being stubborn. So I hope this has been useful for you. Next Friday, I'm going to be talking about communication with your partner. So I'm going to give you my top tips there that are going to help you talk to your partner with the best possible results of getting them, if not to understand exactly what's going on with you with your chronic illness, because that's pretty difficult, but to understand that from now on, life is different. It has changed your relationship, that things are going to need to change, and it's going to be about the two of you adapting to that, and adapting to that as a family, rather than you just being left to deal with it in isolation on your own while they go on with a normal life, right? Which is what normally happens and just makes things feel worse. So I'm just going to take a quick drink. If there's any questions, please ask the questions now and I'll be happy to answer them. Okay, so it looks like there's not any questions. If you're watching this in the replay or if you're watching it on YouTube, please feel free to ask me any questions. I do get the notifications for that, and I will be able to answer the questions for you, whether you're watching this on Facebook or whether you're watching this on my YouTube channel. So thanks for watching, guys. I hope this has been helpful. I'd love to hear your feedback, and I'll be back at the same time next Friday with another live for you. Bye for now.